Thanks for coming for this class. The class is known as Feeling Sad. I call it Stress, Anxiety and Depression. And let TCM help you. Some profile of myself. I'm a TCM practitioner from Singapore, and I have a doctorate in medicine, specialized in TCM, where my PhD research is into the management of diabetic from the TCM perspective, and I'm currently the Vice President of Singapore Acupuncture Association. So that's some of my profile. And today's topic is about health. So I always start with this particular page known as a disclaimer, because material that you receive or you're going to read, you're going to hear from me, are compiled by myself based on my own personal reading, research, study, as well as my clinical observations. So this is we just discussed over online. So bear in mind that if you're not feeling well, it's always important to consult any practitioner in a more professional setting. So information shared will be purely for reference only. So the objective for this class is to allow participants like yourself to have a systematic understanding on how TCM view stress, anxiety and depressions and its effect on our body, and to master TCM healthcare methods such as acupressure massage, medicated diet and breathing techniques and methods. Stress, anxiety and depression. Just about every one of us feel these emotions at some time. We being human, we have feeling about this. They are all common reaction to life challenges, from losing a loved one to going through a crisis like what we are facing now all over the world. There was a study in US for a loss in the family, for someone who lost someone in the family, 9 other person in the family will be affected emotionally. So this is what we are all facing through loving to our loved one, through we love the loved one who lost and come by our life and you go away from our life. Okay, so on the surface they look a lot alike, but there are distinct differences among them. So we'll be exploring them. So what is stress? Stress is a cognitive and behavioral experience jointly constituted by psychological stressor. So they are stressor, and they are psychological stress response. So you take 2 hands to clap. There's a stressor and there's a response. So I have mentioned a few times, my modus operandi is nobody can stress me unless I stress myself. So how we handle stressor make all the difference in how we face the world. So that's what we're going to explore. Alright. So what is stress? Their stressors are factors that guide the stress response. These include the following: biological stressor, such as sleep deprivations, infection. For sleep deprivation, when you watch movie, you want to integrate somebody, you want to gather some information. Making someone not able to sleep. It's a very stressful event. Infection, like what we're going through right now. Whether you get infected or the chances for you to be infected itself is a stressor. Noise. Singapore is a very noisy environment. There are people who cannot stand all the noise. This is the external stressor. Temperature changes. Sudden change of temperatures. So this is a biological stressor. Then we have this thing called mental stressor. Paranoid. It can be internal due to something within the body system reaction. Paranoid. Jealousy. Feeling something lacking. Somebody have it that you don't have. Jealousy. Guilt. Past event bothering you today. Remorse. Sadness. Okay? Then with the social environmental stressor, such as major social changes, like we are going through at this moment. Everybody have this new word nowadays. It's called new norm. So what exactly is a new norm? It's a blank page. is for you to draw. So I always tell people you can draw it colorful, or you can draw it black and white. So it's up to you. So that there are major social changes. Many people lost their jobs, and their loss is forever. And the skill that you acquire for so many years suddenly becomes useless. So socially, things are changing. But how are you going to respond to it make all the difference. So these are stressors. Breakdown of important relationships. I mean, we all have our part of life. I mean, puzzle of life as you age. I mean, so somebody important to you go away for whatever reasons. So it's an environmental stressor, relationship, and most of these stressors they cause psychological problems are comprehensive, meaning they seldom come one at a time. Many a time they come together, and how you respond to it, or you break down, they call it, is all make the difference. So today we share how we can avoid this, how we can make known about it, and how we can react and make some positive steps to take care of it, ourselves and people around us. So that's the objective. And a little stress is needed, beneficial and even healthy. There's one example I have mentioned a few times. Not sure some of you may hear it before. One of the result of stress we typically relate to is called high blood pressure, hypertension. So I come across a patients who are very young, 30 plus, where the blood pressure when I measure is 175, 120, very high. It's a typically a potential time bomb for stroke. They are telling him, you are very stressed. Why you are being responsible? Only a person who is responsible feels stressed because he is responsible for his family, his loved one, his job, everything. But I tell him, the moment you are drop dead, you are being irresponsible. So a little stress drives us to achieve what we cannot do. Okay, I mean you can jump a bit higher, but question is too much stress is no good, but a little stress is good. But how much is a little or how much is too much? That's where the everybody is different. So we need to understand our threshold. Okay, so however, this is why I mentioned it can cause personal injury and it may be damaging to you and all your loved ones as well. So stress can increase the risk of stroke, heart attack, ulcer, internal organ system ulcer, mental and psychological illnesses such as depression and anxiety. So let's bring up the linkage together. Stress led to anxiety and depressions. So how we counter all this? So let's talk about anxiety and depressions. Anxiety is the feeling of fear, worry, uneasiness. It's oriented toward future, something yet to happen. Okay, your fear of something in future, down the road, worried, uneasy. Most of the time, you are overestimating or overestimated the issue on hand. You think you cannot do. You feel that you are inadequate in doing something. But can you actually do it? Sometimes just do it make all the difference. So you overestimate. So by this overestimation, you led to a lot of avoidance. You don't dare to do the step forward. And a feeling of on the edge. Sometimes there's this thing called faith. Just believe and you go. And often they are accompanied by muscle tension. Before you do something, you tense. Okay? Irritability. Someone asking you to do, you simply don't want to do. You get people pushing you. Try your best. Okay? You have this thing called fatigue. And lack of concentration. And from the neurological symptom part of it, there's palpitation. Okay? The feeling of heart jumping a few beats. Or the possibility of like heart is pumping away. Hand shaking. I always claim when I do something who I never do before, the first sign is I take my hand up to see whether my hand shake or not. If my hand shake means I'm stressed. If my hand is okay, for example now I'm conducting this class, my hand stable, so meaning I'm ready for this class. Okay, perspiration, and there's this sense of frequent urination, like it never finish. I mean, we all have this issue before you're conducting exercise. I mean, for me, I speak for myself. When I in army time, before I go for a long run, always ask the sergeant to go for toilet. Okay, this also there's an uneasiness. So anxiety oriented toward the future, overestimating the task on hand. Okay, whereas the other hand, depression is characterized by significant and persistent low mood. Someone always feel very lousy, and this feeling is oriented toward the past. Something happened in the past. Okay? You have done something bad to me. I have done this one, done that. So it's always the past. If fixated over some past incident, you believe that something happened previously will happen again. Okay? Or someone did something bad to you will affect you again. So it's oriented toward the past. So you often feel sad. So this sad feeling keep lingering on. It's not what happened to you today, but what happened yesterday. But all of us understand one thing. All of us today is the product of our yesterday. Our past experience shape who we are today. But it just makes us stronger, better, or accept whoever we are now. But what is past is past. We'll discuss this in short while. But because of this past incident, someone in depression always feels sad, diminished interest in life. So comparing anxiety and depression is more dangerous per se, because you feel that there's no future, something like that. Okay, feel lost interest in life, empty or helpless, and you feel a sense of uselessness because of past incident make you who you are today. Okay, but if someone cannot guide you out from this particular emotional cages, okay, call it, okay, this guilty feeling, fidgeting will keep haunting you today. So depression is on a past incident, make you who you are today, and we can explore how we can break away from this cycle in short while I discuss. So anxiety and depression, they are serious but treatable illnesses, both from the modern medicine perspective and alternative medicine perspective, including TCM. I speak openly for all traditional medicines. Treatable. So it's not unusual for someone to suffer from both conditions at the same time. Especially depression will chances are higher chance to lead to anxiety together. Okay, so these are some definition. And these two also share similar symptoms, like the sense of the nervousness, feeling of nervous, irritability, just feel irritating, right? Insomnia, this is a very common symptoms. I've discussed, this is my first topic I discussed in the series that I complete in July. And the problem of concentrating. It's very quite easy to observe someone having depression or anxiety. Just look into their eyes. Their eye have no focus. It's like always look around, floating around. Okay, but each has their own causes. So we explore that in this couple of hours. So what are the sources of stress? Okay, with our fast-paced activity, currently with the where we are living, where we live in Singapore as well as the modern world, and the increased pressure from our modern life lifestyle, depression, anxiety are more and more common, especially in developed countries, where our social distancing is so near. Okay, open the door, you see your neighbor. Okay, I was a kampong kid. I was a kampong boy in Singapore. The first time I stepped into a HDB flat, a housing block, is when I was 15 years old. I still remember the feeling of open the door and see a wall. This is something that I cannot forget. Because last time when I was in my own house, in my kampong day, my room is 5-room flat house size. Anyway, those are the past. Okay, so there's a growing number of people from around the world are feeling stressed, anxious, and depressed. So what we are currently discussing today is not unique to Singapore alone. And today, although today audience are all Singapore, I have in my past courses I have international audience. So we are not alone. So give me some statistic. Average stress level by gender. Female are always higher than male, because maybe female have more things to take care of, the family, the loved one, the children's, is the mother of the family, okay, mother figure of the family, okay. Then we have this thing called, if you want to observe number of people with anxiety disorder, where they track from 1990 all the way to 2017, it's a linear growth, so it's growing. So as technology advances, our stress level increases. Our response times is require more. Last time in terms of communication, we write letters. After you throw in a letter, it can wait for weeks. Now I send a message. Within a minute, I need a response. So as technology advances, as the world becomes more and more connected, the rate of increases is linear. But you notice one thing, females always more than male. So this is for people with anxiety disorder. Now look at another chart. Number of people with depressions from the world, similarly, from 1990 to 2017. In the span of 17 years, okay, it's a linear growth. As you can see, female more than male. So having a business for females always work in all industry for some reason. So anyway, this is called stress, anxiety, and depressions. It's growing all over the world, not just Singapore. So it's nothing unique to us. So let's discuss what are the source of stress. So work overload. You have more than what you have on hand. Okay, you are giving tasks beyond your capability. So overload. Then there's this thing called work underload. Underload is also very stressful. My personal experience, in my life so far, I was hit 103 times. Okay, during the first time, you're paid so well that no job on hand, you feel very stressed. Because I was told by my boss, first thing, earn your pay. But question is, if there's no activity, it's very stressful. During the CB period, initial time, we notice something. A lot of people have no jobs. Okay, although you are getting salary, you feel that if there are not enough work to justify your jobs, underload, it's a very stress because you're not sure whether it is sustainable. So work underload. Then we have this thing called excessive mental and emotional effort. This is I will discuss it more in TCM perspective. Any emotional swing, over happy, over angry, over sadness, extreme excessive sadness, all this will lead to many stress. These are called stressors in the body. Then we're giving out more and than get in returns. This is a sense of feeling. You feel that you give out more, and your return is not justifiable. But as a boss, we will always want our staff to do more than what they are being given. But question is, it takes both hands to clap. There's only that much you can give, then you expect something in returns. Being human, being selfish, or being normal person. So when you give out more than what it can get in return, you feel stressed. Okay? Then, restrictive promoting pathway. This from the career perspective. You work so hard. You expect the next promotion will come to you, but it never happens. And look around us. We have this type of feeling. And as for the lady, there's this thing called the invisible glass ceiling. It's all over the world, where you believe that your capability is not worse off, in fact better than your male colleague. But somehow you're not given the opportunity to prosper. But these are you are not being promoting because of your ability, but rather there's something else that is trapping you. Okay, so the restrictive promoting pathway. You see there's no future moving forward, and you want to go, and whether you go somewhere or not, it helps. You always ponder whether should you move some. Making career changes itself is a very stressful activity. I myself make a lot of career switch. As I mentioned, I was an engineer. Then I go into finance and HR. Then I go into corporate services. And I do, now I'm a trainer, TCM practitioners. So for every changes, It's a very drastic changes. But the most stressful task is the first time you leave the industry. Thereafter is easy because you try. It's proven. So anyway, restrictive promotion pathway, you can counter it by jumping around, jump ship. But it takes a lot of preparation to do that. We can have some more discussion thereafter. And the lack of sense of control. That was happening now that we can see. We don't know what the future holds. And that make a lot of people, for those who believe in certain religions, I believe in all, I respect all religion. Sometimes in question, when in consultation with my patients, I always ask some question, which religion you belong to? Okay, I'm not preaching any religion. My question is, if there's a need to fall back to some divine guidance, that helps. Because I'm a free thinker, more toward Buddhism because I sent my mother off the Buddhist way. But I spent 2 years in Anglo-Chinese Junior College. So I listen to a lot of Bible. Okay? Like for example, the statement I like most is I don't know what holds tomorrow, but I know but I know who holds my hand. Something along the line. Because future is not up to you to say. In Chinese, 尽人事听天命. So question is, the lack of sense of control is a lot of time you don't know what you're gonna do. Because you believe that you put in so much, but you don't know what the future holds. So this lacking of control is a stress. Then we have this thing called the lack of support systems. When you look back, is there someone there for you? Okay? When you try so hard, is there someone supporting you? And this support system can be from the emotional part of it, or it can be from the, for tangible thing, your computer system, your hardware system, whether it's a support for you. But from the emotional side of it, do you have a home per se or something, a shelter for you to fall back to? A shoulder to cry on, something like along that line, right? Lack of support system. Then organization changes intensify. This is very common stress for those engaged in the work now, especially nowadays. For all of you here, you understand one thing. The worst is yet to come in terms of the organization changes. I retrench people at the age of 30 years old. I've been retrenched. I retrench people. So, and during the period of integration, because I'm responsible in the merger of two companies, we all learn one thing. When there's a crisis looming on in the horizon, you don't need to take care of the best. The best will take care of themselves. But the question is, there will be many out there who are not that ready for any changes. So when organization changes come in, there's always, it fall back to the top. A sense of control is no longer there. Support system is not there. A lot of uncertainty. So this is a stress. So in life, I believe in lifelong learning for that reason. When I retrench people at 30 years old, it prompt me to make time I ask myself one simple question. At 40 years old, where will I be? Because those I retrench are 40 plus. So I make sure that I myself, when I reach 40 plus, I'm retrenchment proof. So there's some life changes. So you learn today something. So going forward, tomorrow, think of something else. There's never too late to change things. Okay, these are stress. Then management style. This is where many of us are stressed by our boss. Or you are the stressor for somebody else. This style of management is, for example, during a CB period, I was told by my patients, her boss have to call for meeting, ad hoc, impromptu, and ask them to on the TV, on the camera, to see where she is. Is she on her desk or somewhere else? So these are the bosses who are very, lack of control, sense of control. They feel that if they cannot see their staff will go away. And the staff, on the other hand, are being stressed by this type of boss. So the management style, there's few ways to look at it. But I practice MBO, management by objective. As long as I get it done, I don't care how it done. I don't care how it is been done, as long as it's done. Okay, so anyways, there are people who management by exception. When things go wrong, then you call me. Things go smoothly, just do what you need to do. So they are management style. Okay, different style. So these are different sources of stress. Okay, and too many bad personality. These are subject to individuals. Whether you yourself adopt certain bad personality, your upbringing. So these are different type of sources of stress. So let's discuss them. And from the modern medicine perspective, genetic or reason can be one of the key driver. Emotional illnesses many a time can be found in the family. So there's certain genetic reason for that to happen. Chemical imbalance. Chemical imbalance come in the form of medication they are taking. Our body is a chemical factory. We are making out of things like sodium, magnesium, calcium, many other chemical components in our body. So all this chemical imbalance, for example, too much potassium, your heart will slow down. You feel very lousy, you feel very tired. Too much calcium, okay, maybe have stone and stuff like that. Sodium, these are all in the kidney sides. So a chemical imbalance, one of the cause for SAD, stress, physical illnesses that you are involved in or currently you have physical illnesses, negative thinking pattern, pessimistic thought, the tongue type, which affect a personal reaction to events. Okay, so some of the medical conditions associated with SAD include the following: cancer. Cancer is a very generic term for something that happened in our body that classified under a case whereby modern medicine cannot cure you. So, but what trigger a cancer? It never, to me, it's never something happened yesterday. TCM perspective view cancer from the point of it all started off from the lack of qi dynamic in the body. But when someone may pronounce cancer, many a time we observe in a clinical setting, a person will go into a state of denial. Why me? And they'll fail to accept what is being prescribed to them, or they'll start look around all over the place for many options of how to handle and how to treat that. When the moment you accept that you have a cancer, that is where cure can start. We cannot face the problem squarely. You will not be able to solve the problem and identify positive steps to solve the problems. So another thing called infection. Infections such as what we know, the COVID, or it can be from the point of eczema and rashes. If you get it, you always question this statement like I mentioned just now, why me? Why so many people exposed to the similar environment? I'm the only person who can be infected. And with the infection that are affecting you, there are many other implications that come thereafter. So another thing is called prescription of drugs such as steroids. Like we have now discussed this thing called the post-COVID syndromes. Okay, many medicine that we take have side effects. While we keep challenging all the other alternative medicine, every time we ask someone to take something in TCM, they ask a question: is there any side effect? But not knowing that all the medicine that you are taking now from the doctor prescribed to you, there are side effects, especially steroid based. We have this thing called especially those medications that address the central nervous systems, okay, where it counter the. I have a patient who have done certain spine surgery, and she has to be constantly taking a medication to address her pain conditions. And this medicine, if it were to reach the fine brain, it led to depression. It led to cases such as the tendency for suicidal thoughts. So these are medication-induced stress. Then we have this thing called the neurological diseases, such as due to vitamin deficiency in our body, lacking of folate, lacking of vitamin B12, B complex and stuff like that. I mean, vitamin B complex are known to be good for the brain. So we talk about end stage renal diseases, where if it's be end stage illnesses, for all chronic illnesses, when you come to the end stage, it's always the challenge of what's next. Okay, in life, not knowing what the future holds, create a lot of stress. So it would be good for, we have this thing called the hospice care, or any of this area of care, because having a religion belief helps a lot, because you know where you will be. But end stage renal failure or end stage illnesses always led to issues such as what's next. Then we have this thing called systemic lupus erythematosus. These are affecting the women more than the men. So these are conditions whereby it will associate with stress, anxiety, and depression. And from a TCM perspective, what are the cause and pathogenesis? Symptoms of stress, anxiety, and depressions fall under the category of mood disorder in TCM. We call it 疫病, mood changes. Okay, so the causes are mainly related to the excessive emotional activities internally or external, how we respond to the external stressor, or weakness in the internal organ visceral system. So there is the external induced pathogens, how our reaction to the external stressor, and our internal organs deterioration or deficiency. So two play a part, 内因 and 外因. Then the pathogenesis is when the regulation function of the liver systems. When you come to TCM, anything that deal with the mood, we place a lot of emphasis on the liver systems. And that also explains why more women having issue related to stress, anxiety, and depression. Because all these are basically part of the regulation function of TCM, and is being maintained by the liver systems. Now, at the transformation function of the spleen system, in order to have good nutrients in our body, in order for the blood to be full of nutrient and circulating the whole body, nourishing the whole body, it requires the spleen function to be optimal, so that the transportation and the transformation function of the body is in place. So if the liver system is not well regulated, when the transport function and the transformation function of the spleen is not well, you result in imbalance within the body, and the nourishing function or the nutrients supposed to be taking care of the heart or the mental activity will be disturbed, and this will transcend into a state of stress, anxiety, and depression, because that mood swing is being manifested as something externally appearance, how you behave, how you look, how you think. So this mental capacity in TCM, the heart is a function. Our mental capacity is a function of our heart systems. If my heart system is pumping well regulated by the liver system, supported by the spleen system, a person will not go into a mental disability such as dementia and such as the kind of the we talk about here today: stress, anxiety, and stress, anxiety, and depressions. Okay, so in our treatment wise, how we approach this, we balance yin and yang. We regulate the yin and yang system of the body. TCM is a balanced medicine. We adjust, we recalibrate. A person is not feeling well because of he or she going into a state of either yang deficiency, yin deficiency, off balance. So you want a balance. And we regulate the qi in the body. We strengthen or support the liver system. And if there's any blockages impeding the flow, we remove the stasis. Some stasis is a blood clot or blood immobility in the body. Okay, so we remove the stasis, reducing by doing so, reducing the internal heat from building up. When the system trying to move and the move is being impeded, heat will generate. I mean, look at our car engine and stuff like that. So we have reduce the internal heat and elimination of the phlegm. Phlegm is a metabolic byproduct that is of due to a coagulation of fluid in our body. What we speed up is called a phlegm. But our internal body, phlegm is a system that encompassing things called cholesterol or any other thicker fluid in the body that is help or that doesn't help in our flow of the body. And we want to invigorating the qi, improving the qi circulation, nourishing the heart and the spleen viscera so as to allow the transportation function and the transformation function to be optimal and promoting the production of qi in the blood. So this is the treatment principle we will adopt. And now we explore the 5 syndromes that we TCM classified: stress, anxiety, and depressions. TCM go through a systematic approach called syndrome differentiations. Syndrome make up of multiple symptoms. I mean, the TCM syndrome differentiation has been around for a few thousand years. We observe something externally to understand what internally. And this empirical proof has been well documented for a few thousand years, and there are a lot of documentation on this. I just completed an entire series of course called TCM Fundamental and Diagnosis, where I have an international audience for people from Abu Dhabi, Denmark, Italy. So anyway, I shall consider conducting the course again if there's interest in that. We talk about how the whole systematic process of us identifying illnesses. So under stress, anxiety, and depression, we classify them into the following 5 category or 5 syndromes. First is called the phlegm and qi stagnation. We call it global sensation. I mean, before I dive into the details, these are typical. Someone feels something, it choke in the throat, esophagus. Always something stuck there, but I don't know why. So we talk about it. We talk about qi stagnation, heatiness. When someone suddenly become angry for unexplained reasons. So because of qi stagnation, it typically associated with frank discomfort on the side of the body. Then we have this thing called the dispirited heat, or a dispirited heart system. It typically due to yin deficiency during post-menopause or immediately after giving birth. Yin deficiency. These are typical in terms of syndrome-wise, and it mostly than not, it will affect female more. So you see this individual suddenly cry, suddenly laugh, okay, like crazy. But typically it's not, just because of dispirited heart systems. Then we talk about the heart and spleen deficiency. This is during the prolonged deficiency, it led to a system weaknesses of the heart as well as the spleen function. And one of the last syndrome differentiation types is known as it is known as heart and kidney yin deficiency. The heart and the kidney, one is a fire element, the other one is a water element. One is yang, one is yin. In order to have balance, just like we observe the Tai Chi diagram, it had a constant movement. And in this constant movement, that's where stability is achieved. And when someone goes into a state of instability of the heart and the kidney yin, a person will transcend into a state of emotional disturbs and insomnia as well. So I'll delve into the individual's understanding of the syndrome now. Before I talk about how we can approach them using acupressure and the use of medical diet and the use of dynamic breath, or we call it qi gong. So the first syndrome, the phlegm and the qi stagnations. So the typical syndrome or symptom that associated with these syndromes, a person will feel depressed. He or she will feel restless. Chest tightness, very tight here. Okay, around the frank area here, distension. Okay, qi distension. Okay, pharynx obstruction. That's I call the global sensation. You will feel something stuck there. You want to swallow in, it can't. It just stay there. You want to pull it out, it's just stay there. It cannot go out. So this sensation typically affect an individual, and the individual feel very lousy because why? He try all means to get it out. You tell someone there's something inside, but they cannot see, because you even tell a GP, you tell the doctors, the doctor asks you to go for a scope, but during the scoping, during the so-called the scope, they cannot see anything, because from a TCM perspective, this is basically a phlegm. A tan, you call it, something choked there, and when upon observation, it's transparent. You cannot observe anything, but you feel something is there. So it's a feeling. So this feeling that you tell your specialist, they cannot see it. Modern medicines is evidence based. What cannot be seen mean don't have. But can you feel it? You can feel it. So this is a dilemma. You feel something and they cannot see it. So what is classified? Psychological problems. So many a time after prolonged diagnosis, you'll be referred to a psychologist. But anyway, TCM classified all this under the case of global sensation. It's a state of emotional disturbance. And what are the organs that typically associate in terms of treatment for this particular syndrome? Is the liver system and the spleen system. Why? The spleen is the source of phlegm. The production of phlegm in the body is basically a metabolic byproduct of spleen. If the spleen fails to metabolize well, the transportation and transformation function of spleen is not optimal. It will result in the formation of phlegm, and this will trap somewhere. So this is liver and spleen will take care of these two. And when it comes to treatments, we are basically regulating the liver viscera, try to resolve the stagnations, and removing the internal phlegm. I will share with you some simple method of massaging later. But in the case of medication wise, we have this thing called 半夏后破汤. It's right, you leave it to the practitioner to prescribe. Okay? So this is first syndromes. The next syndrome I'm going to discuss is called qi stagnation heatiness. This is happened when prolonged, for example, the previous case. It has been there for a long time. And nobody understands how you go through, how you feel. You become very vexed. Okay? A person will behave very quick-tempered, irritable, get angry easily. Besides a chest tightness. And typically when you wake up in the morning, you have bitterness in the mouth. You feel a bitter taste in the mouth. And you have started experiencing headaches, eye redness, meaning internal heat has started to build up. And you start to experiencing tinnitus or tinnitus. You have some ringing sound in the ear, and this sound should be a bit on the louder side, because the ear is the orifice of the kidney systems. When it's very loud or something is disturbing you, from a TCM perspective, is liver system related. If your tinnitus is very soft, occur only when everything is quiet, then it can be pointed to the case of deficiency in the kidney systems. And in this case of qi stagnation heatiness, because of heatiness, you will start to experiencing constipation as well. So in terms of organs that we should focus in are the liver system, the pericardium, and the stomach systems. When I highlight all these organ systems, if they are yoga practitioner here, you can start to stretch or massage the corresponding meridians. Because I teach a lot of yoga instructor, they understand when I mention the organ, you can always focus your stretching along the respective organs meridians. Come next week, I have a course on meridian class. Anyway, so treatment approach wise is to regulate the liver systems, removing the heatiness from the systems by purging. I will suggest a few herbs that can help to cool down the body from internal point of view. So this is called qi stagnation heatiness. There are this thing called the dispirited heart systems. This particular illness is classified under Chinese word called 胀燥, meaning that the organs are going into a state of extreme heatiness due to prolonged yin deficiency. So we typically associate with lady post-menopause, but it can also happen to lady post-delivery. So the typical syndrome presented by this individual, more women than men, is fidgeting, restlessness, okay, weeping and laughing without reason. Sometimes cry, sometimes is laughing without reason. It just, I mean, it's called hysterical to a certain extent, but this is not something he or she want. It's because of ink deficiency, prolonged ink deficiency in the body. So it becomes temperamental. It's very unpredictable. Okay, yawning frequently and unable to control oneself. I mean, in the modern medicine perspective, we classify them under psychological issue. But in TCM point of view, it's called dispirited heart systems. It's basically due to ink deficiency internally, resulted in the organ deficiency. I mean, all organ deficiency, not just the liver alone. So when it comes to management of these particular symptoms, we don't just look at the liver system. We have to take care of the spleen system, where the production of the nutrient, the blood is formed. The liver system, the one regulate the blood in the system, in charge of regulations. The heart systems, that responsible for the mental capacity, and the kidney system, where it take care of the entire ink or the fluid distribution of the whole body. So when someone experiencing a dispirited heart systems, we go through all these things. And it comes to treatments, nourishing the ink, regulating the liver system, and calming the heart systems. So next is called the heart and the spleen deficiency. This is where a person went into a state of, we can observe, worried and suspicious. I mean, everything they're very suspicious. Why? When the lacking of blood in the body, as I say, 心主神明, the heart responsible for the mental capacity. If the heart is not well nourished, okay, the person will start to have in terms of mental capacity wise, may not be that optimal. A lot of suspicious, okay, dizziness and get tired easily. He or she may feel palpitation, a sign of ink deficiency of the heart. Timid, scared of anything, nightmare, okay, insomnia, difficulty falling asleep, poor appetite because of the deficiency of the spleen system. You don't feel like eating, okay. The yellow tone, the skin tone turn pale yellow in compressions. These are typical signs of spleen deficiency, pale yellow color. So the organ system we have to manage is the heart systems, the stomach, and the spleen. So the treatment approach is to invigorating the spleen and the heart system, nourishing it through use of medicines or through use of massage and things like that, and nourishing the qi and the blood. And the last syndrome they want to discuss today is called the heart and the kidney ink deficiency. So a person with such a syndrome will have the following symptoms: restlessness, palpitation. Anything to do with the heart, they will have palpitation. Forgetfulness. When the heart system is being affected, forgetfulness, insomnia will come together. You start to have a lot of dreams, okay, because of lack of support to the mental system. A lot of dreams. The palm and the sole will feel warm. Why? The moment you feel this is very warm, it's a sign of ink deficiency within the body, especially kidney ink deficiency. Irritability, you start to experience night perspiration. When I said night perspiration, it's basically you sit there, do nothing, it just perspire. When you sleep, when you wake up in the middle of the night, your pillow is wet. So it's called night perspiration. And you're experiencing throat dryness in the throat. And the organ to take care is the heart, the pericardium, and the spleen, and the stomach systems. And with treatment approach is to invigorating the spleen, the heart system, nourishing the heart, and the kidney system. So I have basically I have explained the 5 syndromes that we classify under TCM for stress, anxiety, and depressions. So going forward, I'll talk about what are the different approach in terms of identifying the massage acupoint and the use of medical diet for stress, anxiety, and depression. And the point are as follow. Okay, so I give you 6 points. First point is called BL10, 天柱. Second point is called EXHN3, 印堂. One is called celestial. Okay, pardon me, I'll repeat again. The first point is BL10, 天柱, celestial pillar. Second point, EXHN3, 印堂, hall of seal. Third point is called PC06, 内关, inner pass. The fourth point, HT07, 神门, the spirit gate. The fifth point, CV17, 坛中, the chest center. And the last point I shared today is called LV3, 太冲, great search. So all this naming convention I will share in a short while. Okay, now when I talk about BL10, for those new to me, BL stands for bladder meridians. Meridian treatments, the use of acupoint, the use of acupuncture has been endorsed by WHO in 1990s. So we have a corresponding naming convention for all the acupoints. So to allow non-Chinese to understand where to find the point. So BL10 stands for the bladder meridian number 10 point. So this point is known as 天柱. The Chinese translation is known as celestial pillar. So the point is located 1.3 chun lateral to the midline at the height of the Spenner's process of C1. Okay. The unit chun is unique to TCM. It's GUN. It's not inch. Because in TCM naming convention for units, it's unique to the individuals. I cover in great length when I talk about it in my acupressure massage course. So just know somewhere there. The exact point, leave it to the acupuncturist. I'm going to share with you how to use acupressure, meaning the use of your finger. Your finger is very thick, so it's okay. In Singapore, I call it agak-agak, roughly there. So the point is where it's located here. The exact location is here. It's the most effective point to address depressions when it comes to depression. So the point is just below this is called C1. So it's two sides. Okay? And to find the point, you can do this simple action following the lady. But meaning you can use what I suggest to you is instead of you pushing this point, the force of distribution is not equal. So I suggest you put your two hands together, this angle. Pardon me. You show your two thumb ups, close together, and you put it behind and you press the point. So I'll show you a video how to find the point. This is a video I recorded a few days ago. My chair is rotating chair, so you can do this thing. Stop playing. Okay, so repeat. Two thumbs up. Close. Put behind. And you rotate. See? See the two finger? Where you press. Okay, that's me in another setting. You have received all this video at the end of the whole course. Okay. So as you can see, these 2 points behind. Before massaging, relax your whole body. Okay. Use the thumb or index finger to massage the tension for 2 to 3 minutes. Or you can, like what I do, put hand together, bring it back, and massage. Okay, so this is how you can do. Or you can do a simple thing. I share a full screen to all of you. Tap tap. You can tap. Okay, tap. Or you can just press. So these are things that you can do to help you. Okay, let me go to the share again. So the 天柱. Then the next point called 印堂. 印堂 EXHN3. EX stand for extraordinary. HN stand for head and neck. So by looking at the point, 印堂 don't belong to any meridian. That's why I call extraordinary. So it's HN3, this third point on the head and neck area, hall of seals. So the point located at the midline of the two eyebrows. to find the eyebrow to make point here. So, and the point is effect alerting the mind and strengthening the eyesight. So you can do like what this gentleman do. Use the two finger to pinch. Let's see the point first. The point is here. So you can use your thumb and index finger to pinch slightly and pull out the area between the eyebrow like that. Pull out. Okay, this one simple action. Or you can put the thumb, just press it there, and gently rotate and to push up your forehead. This simple action is very calming. In a clinical setting, if I have a patient who is very stressful, I'll apply a needle here, and it's very calming. It calms the whole person down. Okay, so this is called 印堂. Okay, the next point I talk about is called 神门, HT07. The number 7 meridian on the heart meridian. HT stands for heart. Spirit gate. So this point is at the ulnar end of the transverse crease of the wrist and the depression. So to find this point is straightforward. You just trace the side of your hand like this. You trace it down. The moment you feel it, one more time, you trace the side. The moment you reach the end, the so-called your wrist of the hand, there's a depression around here. So there's a depression here. So this point is useful for anxiety, forgetfulness, insomnia, and depression. Pardon me, insomnia and dementia. Every night without fail, I massage this point before I sleep. So you can either use your thumb, okay, to massage the point, okay, or you can use your middle finger. Let me make it big to show you. You can use your thumb to massage around here, or you use the middle finger to press. Okay. So when my hands are together, normally when the hands are together, I'm massaging my 神门. I sleep this way. When I sleep, I'm always massaging my 神门. So to find this point, trace all the way there, you find the 神门 point. Okay. So they call 神门. Two to 3 minutes a day. Okay. Pardon me. Use your thumb or middle finger to gently massage for 2 to 3 minutes. Then with the next point, PC06, stand for pericardium meridian. Number 6 point on the pericardium meridian, known as inner pass. It's on the inner aspect of the forearm, 2 cun above the wrist line between the two tendons. To find this point, you just use your thumb, touches your little finger this way. You'll notice that your tendon will start to protruding up. Use the other hand, gently place on your finger. Pardon me. Show you how to find this point. By putting one thumb gently on your forearm and rotate your hand, you should find 2 parallel tendons. And you put your thumb and the little finger together, you'll notice that the tendons start to protrude out. So this is where you can feel the 2 tendons. And take 3 fingers, for example. So this is the point. Your wrist line and 2 tendons. And it's 3 fingers from the wrist line, and this is the point. This point is very important and useful for those who have chest tightness. Let me share the screen now again. So at this point, massaging this point help to maintain the heart, relieve heartache, palpitation, and chest tightness. This is the most commercialized point in all the acupoint in the body. If for those who have, the motion sickness, like to vomit when you go to the boat, go to the car, go to the plane, you can go to the lounge and buy the jet lag bag or things like that. But this is where you can massage this and it can help to maintain and manage such a symptom. It unbind the chest. Okay, it can help to address palpitation, insomnia. Right? So use the thumb of one hand with a little pressure on part of the 内关 on one hand, and you gently open and close your hand. This opening and closing help a lot in terms of management. Instead of you pressing your thumb, just put your thumb there and open and close your hand. This is good enough. Okay. Next point we talk about is called the 痰中. 痰中 CV17, known as the number 17 point on the conception vessel or conception channels, called 任脉. So it's called the chest center. The point is in the middle of the two nipple. Okay, this point is very unique because it's a vending hole, vending acupoint of the body. Meaning, when the qi is stuffiness in the body, you need to let it out. When you're very angry and very sad, you don't know how. Then what you do? Massage your 痰中. I mean, you see people do this action like, oh, King Kong, oh, why not here? It's because this simple action of you knocking your chest, unbind the chest. You vent your frustration. Even gorilla do that. Okay, 痰中. So the point is here. And relax and breathe naturally, rubbing the 痰中 or 散中 with the thumb until you feel some soreness. Okay, you can rub it for 1 minute, 2 to 3 times a day. Or you can gently hit it. It's by all means hit it. So it's called 痰中. And the last point I'll share tonight is called 太冲, LV3. It's a liver meridian, number 3rd point on the liver meridian. Great search. Liver meridian is a most important meridian that you come to regulate emotional disorder or every kind of emotional disorder. So it's on the dorsal of the foot in the depression at the junction of the first and the second metatarsal bone. It's a coming point for anger, irritability, insomnia or anxiety. So the point is here. To find this point, you just trace all the way this number first and second metatarsal bone. One more time. Trace and they meet each other. So this depression is where the Tai Chong is. If you have the opportunity to press it now, if it's a bit sore and pain, chances are you are currently going through a stage of either depression or very stressful or anxiety. So the idea is to massage this point till you don't feel any pain. So it's a very calming point, very good calming point for anger, irritability, insomnia and anxiety. So the massage it, relax, breathe naturally, rubbing it with heel or one foot or with the thumb to make it sore. Meaning, while you're attending my course, now you can take one side of a heel to start massaging your Tai Chong, like what I'm doing now actually. Okay, so the idea is don't waste time. And this zone correspond to those who believe in foot reflexology, your lymphatic system, your breast lymphatic system. This point. So idea is like that. I was shared by my masseuse. As you press here, if you feel something lumpy along it, you call it 结节 in Chinese. It meaning that on your chest or breast area, something is not right as well. So the idea is make it smooth. Make it smooth. Okay? So you can rub for a minute or so. Okay? Or as and when you like it. So I will share the 6 acupoint. So let me touch on the use of herbs or foods. So Chinese medicine and food commonly used in treatment of SAD. First, in TCM, food and medicine originate from same source. You call it 药食同源. Similarly, Hippocrates, the father of modern medicines, also mentioned the same thing. Let thy food be thy medicine. Thy medicine be thy food. So food are medicine, medicine are food. So I will share a few medicine or food. So there are Chinese medicine called roses, wheat grain, lily or lily bug, and white phoenix roots. And one, correct. Okay, so first, roses are red. Roses are good. For those who have listened to me 2 weeks ago and watched a documentary on TV, I'm not sure which channel, they talk about roses. So roses is sweet, slightly on the bitter side, and slightly warm. Roses enter the liver meridian, the spleen meridian, and the stomach meridian. And liver has its following function: it regulates liver qi stagnation. It's a very calming herb or calming flower. It relieves depression, it manages menstruation issue. So simple flower, put into your teapot and just drink. It's very calming. My home have a lot of roses. Okay. Next is called wheat grain. 佛小麦 or wheat grass have similar effect as well. It belongs to the sweet and the cool category. Under this property, it belongs to the heart systems. This wheat grain help to cleanse deficiency, heatiness from the within our body, especially the heart system. It manages perspiration. In TCM, perspiration is a function of the heart. Sweat is the fluid of the heart systems. So if someone keep perspiring, it points to the fact that his heart system is on the deficiency side. So wheat grain helps in managing this particular function. We have this thing called white phoenix root, 白芍 or 芍药. It has the following taste: bitter, slightly sour, and slightly cold. Any taste that's sour in nature will help to manage and regulate the liver system. That's the reason why women are encouraged to take more vinegar, 多吃醋, because sour in taste help to maintain liver system. So this white phoenix root enter the liver and the spleen meridian. It nourishes the spleen and the blood. It regulates the liver systems and help manage pain internally, especially when the pain is a byproduct of anger or depressions. Okay, so then we talk about lily bug, 百合. 百合 is sweet, bland, and slightly on the cold side. It belongs to the heart and the lung meridians. So this lily bug help to moisten the lung. It clear internal heatiness, internal heat due to yin deficiency, and have a calming effect. So these are very common herbs. They can be it can be used in your daily activity. You can eat every day. All these herbs are easily found in my refrigerator, by the way. So let me discuss how some of the recipe that you can consider using that. First, it's called lily bug. Okay, you can use to cook a rice. Okay, licorice white dates tea, 甘麦大枣汤. Okay, 甘麦大枣汤. Okay, so this is a good medicine formula, highly recommended for just now I mentioned the heart, the dispirited heart systems. Okay, this is documented in 黄帝内经 2,500 years ago. So suitable for those who are suffering from what I mentioned just now: dispirited heart systems, hallucination, irritability, insomnia. 3 simple things: wheat grass, wheat grain, red dates, and licorice. Just boil for half an hour and you can drink. Rose tea. Just take roses and water, pour. Warm water, hot water is fine. Okay, just pour. The moment you drink it, immediately you can feel a calmness kick in. That's how I personally feel, by the way. So it promotes qi flow, resolve depression, and relieve pain. Because I said, when there's stagnation of qi in the body, your body simply feel uncomfortable. So with this thing called lotus seed lily rice. Okay, what you can do is lotus seed and lily bug. Just take a bowl. You soak them for half an hour. Then you cook together with your rice. Okay. I may have cup up to you. I indicate 2 cups of rice. It's calming and nourishing. So this is how it looks like. Artist impression. I take this very often in my family. Lotus seed and lily bulb are standard things in my fridge. Okay. If you have a school-going age children at home, or you have family member engaging in very stressful life activity, you are encouraged to cook this type of simple dishes every other day. It's fine. Okay, these are stable diet. Then, food, phoenix root liquorized tea. 芍药甘草汤. There are many people ask, is there any painkiller in TCM? This is a typical painkiller formula. Just 2 herbs, okay? Or 3, or put in the red dates is fine, okay? White phoenix roots, licorice, these 2, and some red dates to enhance the taste. This formula regulate and nourish the liver system, the spleen system, and the blood system. And it help to relieve stomach pain or pain around the side of the chest. And this stomach pain, it can be in a way, some of us may feel pain, not at the stomach, but at the back. If you have a backache that is around, how should I say, L1, L2, or the T7 around the area, okay? This is where it's nothing to do with your spine. Chances are it belong to your stomach discomfort that radiate to the back. So this is where a phoenix root liquorized tea may help. Okay, so this is where I cover the acupoint. I cover some of the herbs that you can consider using. Now I go into the another dimensions. We call it meditations. Okay, meditation is beyond religion. Okay, I call it health resonant qi or meditation. So question is, can you meditate? Okay, if one simple questions, do you worry? If you are a person who always worry about things, you can meditate. Why? Because if you can worry, mean you like to focus in something. And meditation is simply put is focus thinking. So instead of focusing the future, focusing the past, why not focusing now? So this is called meditation. 活在当下. Okay, so let's do some simple action called simple meditations. Okay, there are many religions who give you some sound, and this sound, if you read in certain tone, it helps you to maintain a calmness. Here I'm sharing with you from the TCM perspective. TCM knowledge in treatment go beyond just use of medicines or acupoints. In the 5 element application, where 5 sound, where 5 tone, musics, okay, where 5 color, where 5 aroma. So all this can be traced to the 5 element theory in TCM that we can put into application to help us as a TCM practitioner to cure individuals. As a TCM practitioner, we must know the art of war, because 用药如用兵. To counter illnesses, we go beyond just the use of medicines or acupoint. So now I'm sharing with you the use of sound through the pronunciation of Chinese character. This is an extract from this thing called 6 character Qigong pronunciation, called 六字诀. So by creating a sound, you create a resonant vibration that exercises the internal organ system. Through many thousand years of empirical proof, this sound create our corresponding organ vibration. Each organ has their respective frequency. So this sound regulates the qi and the blood and balancing yin and the yang. In total, there's 6 sounds. I'll share with you 1 sound today. Relax, inhale deeply. You use your diaphragmatic breathing, meaning you inhale to the diaphragm. Okay. you can press your forefinger next to the external corner of your eye. That's why a few reasons, okay? In terms of pediatric massage, your forefinger or index finger correspond to the liver systems. The thumb, spleen, index finger, liver system, middle finger, heart system, ring finger, lung system, little finger, kidney system. So this is called liver system. And in terms of eye zone acupuncture, the corner of your eye correspond to the liver system as well. So you basically put everything together. As you relax and inhale deeply to the diaphragm, you put your index finger next to the corner of your eye and you exhale as much as you can. In terms of the TCM, Health Resonant Qigong practice, there's only one type of inhaling. You inhale to the diaphragm. By you doing deep breathing or diaphragmatic breathing, it helps the body to go into a state of generating this thing called alpha wave. Alpha wave itself is very calming. So as you inhale, you exhale, you pronounce a sound known as she, S-H-E, for those who have difficulty pronouncing a Hanyu pinyin. Okay, S-H-E. So inhale, and just inhale again. This simple action will help to regulate and soothe and calm the liver organ system, and it helps to regulate the internal qi in the body. So now I want to combine the sound and those acupoint that I mentioned just now to all of you before we end this thing. This is where you can put all your practice into together. For example, now you have this point. You can put your finger there, relax, and you inhale. This help and calm you down. Okay. Similarly, other point, you press. Okay. All other point, you can do the same thing. As you inhale and exhale, the longer that you take in and take out, the longer that you inhale and you exhale, the calmer you become. In research, most people 1 minute inhale and exhale more than 12 to 14 times. As a trained practitioner, you can 1 minute 4 times or 1 minute 2 times. As your breath becomes slower and slower, it becomes calmer and calmer. You make every breath count. When you do diaphragmatic breathing, as you do diaphragmatic breathing, we talk about the air going into your diaphragm. The air can never go into the diaphragm. But this action of mind over body telling your air to enter the body, you relax your rib cage and your entire lung areas is fully occupied. As you more and more engage in such breathing exercise, your lung capacity will increase. By making every breath count, you won't get tired very easily. You call it 中气十足. So this is where Qigong, together with sound, and meditation is basically focused thinking. While you're doing that for 2-3 minutes, you just gently breathe in and out for the 5 to 6 times. It's good enough. It's very calming, and this something will help you. And one thing about stress or emotional issue, anything that's emotional in nature is your own personal problems. Whether you're sad, angry, happy, worried, All this doesn't concern anyone. Nobody care whether you are sad, worried, happy or not. These are your internal response to external stimuli, whether it's a stressor or happy occasions. You should maintain a very stable emotion, come what may. So when it comes to treatment of stress, anxiety and depressions, it all boils down to a few things. The main treatment is divert the patient's attention and feelings. There's no need to worry too much about the past. The past has happened. The future is for us to go and develop and explore. Am I worried about the future? Of course. Okay? But the question is, does worry help? It doesn't. So one of the first book that I read when I started working in 1993 is this book called Don't Worry, Start Living. It's a very good book. Okay, you can, but now that it's out of print, but you can find this book. Because a lot of time we worry for things that never happens. Okay, but to divert the attention to look at something, that is to observe and detect early symptoms. Well, I mentioned just now, stress, anxiety, and depression. These are difficult illnesses, but it's treatable. Okay, from counseling, from observing, and from bringing the person to an environment that is more accommodative, a better support will help. Encourage the participate in social activities. This CB period is very bad and detrimental to a lot of people suffering from emotional symptoms. Because human beings are social animals. We need to come into contact with somebody. The sense of touch is very important. Okay, a lot of people feel the touching side of it. But I mean, if you can touch someone, go hug a tree. I mean, I share this thing about hugging a tree since 2016. Lately, someone talked about it. I have documented proof about it. I talked about hugging a tree many years ago. So engage in social activities. Now that we cannot engage physically, now I'm engaging through you through Zoom. Okay. Then we can also encourage adopt positive thinking. Thinking of what to do next. Okay. And we have this statement to conclude. Yesterday is a history. Tomorrow is a mystery. Okay. And today is a gift. That's why I call it a present. I mean, it can be a very, how should I say, everybody talk about this statement. But truly, this statement means something. Our history shaped who we are today. That's it. Tomorrow is a blank page. Now is a new norm. It's better. Everybody start from equal ground. Nobody have a head start per se. So, draw your own picture, be it black and white, be it colorful. Do your own, okay? Today is a gift. Stay where you are, and I'm glad you share the gift today with me today. That brings me to this thing called Q&A. For Lily, your daughter is basically anxiety. This is a typical symptom for entire suite of anxiety behavior. So, it's through counseling, tell her she's good enough. She's well prepared. No need to worry so much. Just do it. Performance anxiety is a person feel that he's not adequate enough. But question is, if you try your best, it's easy said than done, but that's how it should be said anyway. And if she try, and she still cannot get it, move on. In life, there are many other things she can do. Okay, life is a journey. I started off as a computer engineer. Now I'm a TCM practitioner come consultant. Do I imagine myself to be a TCM practitioner when I become an engineer? I'm not. But being a trainer, being a lecturer in the private university, I always tell my student one statement. You don't know what you don't know until you know. And the more you know, the more you don't know. For example, when you're walking through a building, in front there's a corner. Do you know what after the corner? You don't know. So as you walk to the corner, then you look, wow, beautiful scene. Then you proceed further. So you don't know what you don't know until you know, right? And you reach the corner, suddenly you know that something you don't know. So you explore again. So life is like that. Now I become a TCM practitioner. In 10 years time, who am I? I don't know. I seriously say I don't know. But life is a journey, just move on. Okay? So if your daughter is doing well, I mean, say that we all went through this process. So before I go for a run, I have diarrhea. But I just run, you finish the run. So start something. Change the activity. Life is not just about achieving something. Something simple in life, do it well, become extraordinary. Thank you.